Debbie Bunker, are you still here from U Inc?
Yes, I am.
All right. Would you mind jumping in and kind of telling us of what you're seeing and what you're doing and what kinds of things people can access?
Sure. I'm going to read from a flyer that was sent out in a blast because it's well organized. So first of all of our staff are working remotely. We get our phone calls relayed to us from the office. So the main number for the Family Resource Center is 508-796-1411. And then for ongoing case management, if someone has already been working with one of us, we each have desk phone numbers, and those phone calls are relayed to us as well. So the services that we're able to answer questions and provide connections to community resources include food, clothing, and household goods, housing, employment, unemployment, and job search, school support, financial assistance and benefit applications, transportation, legal assistance, health, mental health and substance use and recovery supports, and childcare and parent-child activities.
Wow.
Yeah, so it's the gamut, and just for example, my role as clinician there is to continue to do assessment and support services for families of children at risk of juvenile court involvement due to truancy, behavioral concerns, or running away. And of course, since everybody's at home, we're not getting too many of those kind of referrals. But if parents are concerned about how they are managing with their kids in the home setting, to definitely call, and probably the case would be referred to me. We are not offering any parent groups online right now. That may change, but that is a big feature of the activities that all of the staff at the Worcester Family Resource Center participate in. Another resource that we offer teens is to get them connected with the Arts and Music Police Partnership Program, otherwise known as AMP. Now that isn't happening right now, but it may down the road if we're still all at home. And we can certainly connect kids with the facilitators of that group so that once the group is up and running again, they can just slide right in. And our hope is to run a summer DBT skills group for teens over at the office.
That sounds great. So Deb, if people just contact U Inc., you will be able to help them connect with the specific service they need. And things are all still running in a virtual way, and you still have capacity, especially around behavioral health?
Yes. So again, they don't have to contact the main number at U Inc. if they need some assistance in kind of discussing what might be options for themselves, either individual counseling or in-home therapy services. They might want to call our main office, and then we can do some assistance with triage. And that, again, the main number is 508-796-1411.
Excellent. Thank you so much. And we'll keep pushing those out on our Facebook page. But I've heard that across the city that people aren't necessarily seeking the help that they might need, even though help really is still out there for people. So please let your people you're working with know that whatever they need, there are things still happening. People are still working on these important issues.
Right.
Tommy, did you want to talk about WIC for a second?
Yes, please. So, hello, everyone.
Hello.
The WIC office is currently doing phone appointments only. People who are already on WIC, we are automatically renewing their benefits for the next 90 days. And then new clients, we are doing everything over the phone, and whatever documentation we may need, we are asking them to email it to us. The main WIC number, we are receiving about maybe 100 calls per day. So
Wow.
sometimes it may not be open for clients to reach. So on the chart, and then I can also send an email, I've put my extension number. Not that many people call my extension. So if you have any clients who need immediate service, you can have them call through my extension. And then we are also asking, if you have any clients, you can email their first name and their phone number, and we can either text them or call them to be able to do the appointment. And anyone can go shopping for WIC clients. And the clients can also change their password as many times. So even if they don't trust the person, they can have the person go just for the day. And then right afterwards, they can call us to be able to change their password for their card. And some of the stores are also telling clients that some of the food items are not available. So we are advising all our clients to get the WIC app on their phone, because with their app, they can specifically know what food items they have on their app. And then also some of the clients may have issues in terms of reaching the other WIC offices around the state. So even if they don't live in Worcester, they can call the Worcester office and we'll be able to help them. And I think that's the updates that I have for now.
Awesome. Thank you so much.
Thank you.
Again, if you are just tuning in and you have resources and supports, if you could type that into the chat, that would be wonderful. I'm going to get started now, but we will kind of come back to resources and things to share. We're so grateful to all of you for tuning in and for paying attention to this important topic. Just by way of introduction, if you don't already know Raquel Castro-Corazzini and Kathy Esparza, I'm surprised to hear that. They have both been in the city throughout their adulthood, making an incredible difference as youth and community organizers. Really thinking about this topic, we know that racism impacts people. And Kathy and Raquel have been tuned into that and thinking about that since the beginning of their since the beginning of their careers, both of them. And we're so grateful that they keep really asking people to think about being inclusive and looking at the ways they are or are not supporting people. And really what health disparities is to me in so many ways is the physical manifestations of racism in particular, and of not living in a just and fair culture and society. We have this opportunity now to really take a much closer look at this issue and this topic. And we're really grateful that we have such talented and knowledgeable women to kind of take us through how this is playing out in COVID, what it looks like. And we will, in fact, even, if people could mute themselves, that would be awesome. And we will, in fact, at the end, talk about what you can do about this and ways you can take action. It is exciting that people are paying attention to this now. And I am going to just turn it on over to Kathy and Raquel. Again, mute yourself if you are not Kathy or Raquel. Thanks so much.
Thank you so much, Amy, for that really kind introduction. My name is Raquel Castro-Corazzini. I wear a lot of hats. The hat that I'm wearing today is as the Director of the Division of Equal Opportunities under the Department of Health and Human Services for the City of Worcester. And so just by the nature of that hat, talking about health disparities and understanding equity is an essential part of how we serve our young people with thinking of it with the lens of justice. So I'm happy to be here today, and I decided to try this platform and see how it goes.
Good afternoon, everyone. I'm Kathy Esparza. I also work in the Department of Health and Human Services through the Division of Youth Opportunities. I'm the Special Projects Manager there. In echoing the things that Raquel mentioned, a lot of what we do in our different projects and programs is really thinking about public health work, addressing equity, creating more justice, and really thinking about prevention work and that as a tool for healing all of the years of oppression and unequal systems that exist in our society.
So we'll get right to it. So these are just what we're hoping to get out of this conversation today. One, we know that importance of shared language is essential to communication and the way that we approach our work. So we're hoping to do a little bit of that. We also are going to be talking a lot about the social determinants of health, and how we're seeing them really. I think it's almost impossible to not see how inequity is playing out as we're seeing casualties and data and numbers that are being reported. So we're going to talk a little bit about that, and then we want to talk about the systems that we're all working in. I mean, I always say to people that I am a government employee. It's one of the oldest institutions, and within that, there's a lot of like broken pieces to that system. But within there's opportunity for us to utilize whatever influence or situational power we have in order to create change. And so we're gonna have a little bit of conversation about how systemically we can do that.
Great, and so just a really quick rundown on today's agenda. So we're gonna start the activity, our presentation with an activity, and then we're gonna talk a little bit about implicit bias, stereotypes, health equity. We are going to be talking about social determinants of health and really thinking about how those impact our livelihoods. We also gonna be talking a little bit about the current crisis and some opportunities for cooperation and mutual aid amongst ourselves in our communities.
So we're gonna try this out, and bear with us as Kathy's gonna be live capturing some interaction through the message app here. And so we're constantly thinking about things from a lens of like, you know, what can we do to help? But if I would like to ask folks to think a little bit like farther upstream. So we're thinking, okay, how can I do to help? How can I support? And we want to start by posing this question of why do people think people are poor? And so in the message piece, if you could please put down why you think people are poor. I'll give you an example of a way that, you know, if I was asked that question and I could only give one answer, so we're asking people to one answer because I can think of many. I would say that people are poor because of, you could say, health disparities. You know, people have to pay for healthcare in different ways, and that can cause poverty. I could say education, anything really. We want to really capture what our audience kind of thinks of why people are poor. So we'll give you a couple of minutes to do so, and Kathy is gonna then write them all down, and we're gonna analyze what came of why people are poor. Something to keep in mind as you're thinking about why people are poor is I think it's fair for you to put on your institutional hat on, because I think it really matters as we have this conversation, the way that we are approaching today's doesn't just have to be from a personal place. If you're here for personal reasons, that's even better. But if you're here for professional reasons and really want to think about, really people's conditions and how people are going to be surviving during these difficult times and how your agency is supporting them, I think it's fair for folks to still, like, I think it really does matter for us to be thinking about, how does why does my institution think, people have problems with access issues and poverty? How does my institution think about what are the challenges that that create conditions of poverty, and are we talking about it from, like, is it a personal choice? Do we come at it from a lens of personal accountability? Do we come at it from a lens of systemic barriers? Do we come from it from a lens of lack of opportunity, being in the right place at the right time? I mean, those are all arguments that are constantly being made around people's conditions of access. And so the way that we are all talking about it makes a huge difference in the strategies that we're utilizing. And so I think it really does make a huge difference for people to really, for us to have a shared knowledge of, like, why we think people are poor and the complexity that causes conditions of poverty. I think that, we're also talking about it here in the U.S. Poverty in other places in the world, have different roots. And so I really want to focus our conversation here, but it doesn't have to be here locally in Worcester. I'm more thinking about here in the U.S. And so I'm starting to see some answers pop up. Really thank the audience for their participation. Hopefully we're trying to keep you engaged in different ways, and so we're going to do a little bit of this to make sure that we are not the only ones putting information into the conversations, but that this is kind of a opportunity where you're helping frame the conversation. So the diversity of people that come to this conversation really does enrich what we're able to, as facilitators, put out. And so I'm seeing culturally responsive care. I'm seeing capitalism. I'm seeing access to resources. Here we are. So, we took a chunk of what we saw people put out there. I'll give you a second to, I think education is an important piece. I'm seeing education come in too. I think that this list is really important part of the when we think about people being poor, and we're thinking about a lot of these things don't necessarily immediately pick on a person and say, you're lazy. I look at this and I think of people thinking about, well, there's a system at play that's creating conditions, and there's definitely a place where sometimes where you grew up, if we're talking about the cycle of poverty, I love, Malcolm X in one of his speeches does a really great job at talking about, if you grew up in poor housing, then you most likely, your housing and where you live is connected to your educational system, then you have access to poor educational system. If you have access to poor educational system, the likelihood of getting a poor paying job is really high, which then lands you again in poor housing. And so those cycles of poverty are really an important part of things. And so now that we're talking about trauma, generational trauma, definitely systemic racism, as we're thinking about that, we want to now pose to you a second question. So with this list in mind, we want to now pose a second question. So I'm going to talk a little bit about, I'm going to pose out a case study. Yeah, thank you, Kathy. So in this case study, one of the, so I'm going to tell everybody a story, and then I'm going to ask you a question. So let's say that in this craziness of the crisis that we're in right now, going to the grocery store is one of the most stressful things to do, right? For all sorts of reasons now, new reasons. I mean, sometimes going to the grocery store in general is stressful. But now I think it's really spiked. And so let's say that you have to go to the grocery store to get a really important, diapers for your child, or you didn't get your last, you need to get medicine or something. And so you go to the grocery store because you have to. You really don't want to. You're ordering your groceries and you have to go to the grocery store. When you get to the grocery store, you have one thing, you're getting in the line of 10 items or less, right? You're hoping to get home fast and get out of being outside or being in a shared space. And all of a sudden, as you're beaming your way to the line of only 10 items or less, a lady cuts in front of you. They have a group of kids, small children with them at the grocery store. And they get into the line of 10 items or less, but they got a whole huge cart full of things. And so they're not supposed to be in this line, and now you have to get in line behind them and all their kids. Now, I'm going to ask you to put on a different hat, because I don't want to accuse anybody of what I'm about to ask them to do. I want you to be a person that perhaps hasn't had time to consider social justice pedagogy. Maybe you're a person that just feels frustrated and angry, and at that exact moment you have a snap judgment about this person, this woman that just cut in line, or got in the wrong line, or felt like disrespected the line, whatever, whatever lens you're looking at it from. And I want you to now, in the message, put in your answers what you think could possibly somebody else be thinking as they're thinking about what this person, the judgments that they could be giving this person. So is this person irresponsible? Would that be the first thing you're thinking about? Is this person selfish? Is that the first thing you're thinking about? Are you looking at what they're wearing? Are you looking, oh, look at this person, what they have in their car. Can they afford this meal? Why do they have all these kids out here at this grocery store? How unsafe? So what I want from the audience specifically is, what could be stereotypes that people would look at this person. Now, all of a sudden, she now pulls out her EBT card. You see them pull out their EBT card. What do people in some spaces, not necessarily you, but what do people in some spaces, how could they possibly be thinking about this person? And so in the message, put in what stereotypes we've seen on television that they portray these characters as, that we see in movies and all sorts of media, that people are looking at people like this woman with all the kids and all the food and the EBT card, and what are the stereotypes that they could be saying about this person. I will put myself out there as the first one to be like, oh, here we go. Like, all these kids, probably, how many baby daddies does she have? So like, these are stereotypes that we see all the time. So I'm accusing myself of not always like thinking of like, oh, this must be a wonderful, person that, didn't see the line of 10, it must have been an accident, and those are probably all her friends' children, and she's a child care provider, and she's buying food. There's 1,000 things that I could go that are way more positive, but if I gotta be honest, sometimes it'll slip out the stuff that I've picked up in my life. So we're gonna try to put these up here. So please help us create a list. What are the stereotypes? Oh yeah, the welfare queen, popular? What are other stereotypes? Again, I know these are not your thoughts. Yep. Welfare mom. Yep. Entitled, taking advantage of systems. Don't really need it. Yes, people totally are looking at what they're eating. Oh my gosh, imagine if she has shrimp in there. It's a wrap. Steaks? Somebody like that should not be eating steaks. Are we looking at their clothes? Are we looking at what kind of shoes they got on? What kind of clothes their kids got on? So think about what somebody else might stereotypically think. Yeah, we're judging everything from their hair. Do they got a manicure? Do they got, do they go to the salon? How do they got money to go to the salon? Does she have, how can she have money to buy things that I don't have money and I'm not even receiving assistance and I have to work so hard for myself? Great. Thank you all for participating. I know that this activity always catches people a little bit off guard because we're conditioned in many ways to shoot those things down. But the reality of things is that we're all consuming media and information and stereotypes all the time. And the challenge is when we are consuming content and we are consuming stereotypes. We are, watching the same characters on television play the villain. We're always watching the same characters on television play the hero, the heroine. Like it's always, it's always a running wheel of who's the bad guy and who's the good guy. And so it's realistic, and it's in many ways almost impossible to think about not being impacted by that at all. That you didn't accidentally, without your consent, consume information that is wrong. And so as we're in this, as we're people that are doing this work or interacting as humans with each other, we have to start thinking about, well, what are the things that are sitting way back here in my head? Like, what is it all the way back here in my head that I sometimes don't know is making decisions for me? What is that deep-seated image or that deep-seated value that I've never thought about or I don't put mind to, that perhaps is influencing the way that I see the world? When I see someone from this race, or I see someone from this religion, or I see somebody from this gender, or not understanding somebody's gender identity, what is it all the way back in my head that perhaps is pulling forward and making decisions for me? And that's what the implicit bias does. I also think that the important part of the two of these is that when we're thinking about stereotypes and what role that they have in our society, what we don't understand is how those stereotypes live in our brains, and what those stereotypes, in times when we're not making a conscious, or we don't have time to think, how do those stereotypes act out in our behaviors? And so one thing that we're constantly talking about is people that have roles in making snap decisions. Many of the times when you're making a snap decision, when you're a classroom teacher and you have to settle down a classroom, who do we hear the volume of all the kids up high, whose volume for some reason seems higher than everybody else's, whose behavior seems more disruptive. And we know, statistically speaking, not an opinion, statistically speaking, we know who's being suspended at higher rates. And so we know who's getting reprimanded more. We know who is receiving more dire consequences. And so all this to say that when we looked at the first list and we created a list of why people are poor, if we can go back to that really quickly, Kathy. And when we think about the idea of why people are poor, it's easy for us to create a list that talks about all the outside factors, all the systemic factors that impact. That's what we know is supposed to be our go-to. People are poor because of this. But when we looked at that woman and that human being at that moment, this list does not reflect the other list. Because it's easy for us to think about the idea of people experiencing difficulty and challenge because systems are broken. But when we look at people at that moment, at that second, and make that snap judgment, all of a sudden, sometimes those things disappear. And that's why that's why implicit bias can be so dangerous. And that's why the work to be conscious actors in our life and be critical questions, asking ourselves those critical questions, is such a big part of creating equity in the work that we do.
So Raquel, I have a question.
Sure.
So would you say then that one way to help with that, having sort of a self-awareness, before you go ahead and you post that judgment, as teachers in the classroom, I can't judge any one of my kids. We never ask how they got to our school. We never ask. They eventually will usually let us in about what some of the things that they face as far as challenges go. So really it becomes being more aware, number one, of your privilege, especially your white privilege, and number two, of your social location, and number three, of understanding that at some point that was a young child who was in a classroom who maybe, that's where all of this started. That's how would you say that that people in general can increase, I'm thinking, of course, from an educator's point of view, self-awareness before posting judgments. Like, I wouldn't have judged that woman in the store because of understanding the circumstance, but if I wasn't thinking, probably.
Yeah, and we all were able to pull a stereotype that we have heard. Like, that's the thing, is like, it's not like you're like, what? I've never heard anybody say anything judgmental about a person like that. That's a completely new subject to me. I've never heard that. I've never seen anything on TV that, that has the welfare queen look like that. Everybody has seen it or heard it or thought it at some point. I think that the challenge that we have for ourselves is that critical question. I always think about the trauma-informed piece, where I remember when I started this work a while ago, we all had the conversation of like, oh, well, that kid has experienced trauma, so like, we're gonna wear white gloves with them, or we try to tell each other that this kid is having a bad day, and we should, if we can get that information from home that something happened, that helps. But we've moved so much far away from that, from just now saying like, if we just act trauma informed and assume everyone has experienced trauma, then we're never concerned with accidentally causing more harm. And I think that the question for us has to be then, how do we change our lens and always approach it from that first list as the rule of thumb. And that is only with practice, because we are also all shedding, when I always say that when we talk about racism hurting us all, this is a perfect example of how racism hurts everyone. Racism doesn't discriminate where it's sending its really negative messaging. Racism is sending that messaging to everyone, which then strips away people from their humanity. And that's a loss for the perpetrator, and that's a loss for the victim. And so while we are having this question about like, well, how do we work to get there? The biggest question is the one that we have to ask ourselves of, are we constantly critically questioning, and are we thinking about this from a systemic level? Because the individual things happen, and everybody has a story about an individual that was able to, I'm a teen mom, and I was able to go to college and get a master's degree and all this stuff. But I know that I had, my situation is individual. And so it's hard for me to tell people, like, well, if you just work hard enough, teen mom, you can do it too, because I know that circumstances are that systemically, that things are set up for failures to happen for some people more than others. And I think that it's never cutting anybody slack because of that, but it is being a conscious actor of it. And I think that's what we can all do, is be conscious actors. I'm gonna pass it to Kathy. Thank you for that question.
Great. And so that exercise was to help us frame our conversation today, and to really think about, how does it look like when we're thinking about systems versus individual choices, and the impact that systems have in the set of choices that we have, because not all of us have the same set of choices. Something that I like to use as analogy for this conversation is, I love planting plants and taking care of plants, and all of them need different things. And it's the same for all of us. Based on our identities, based on our realities, we all do need different things. And equality doesn't mean equity, meaning that not giving the same amount of things to everyone doesn't do justice for all of us. So something that we want to talk about right now, and we're gonna ask you to use the chat as well, is to really think about some of the different factors that impact our livelihoods and our health. And if you can tell us, how do you think those impact our realities? So for example, when we're thinking about education, how does that impact our health? When we are thinking about economy, how does that impact our health? Our access to food. So if you can take a couple minutes to write your answers on the chat. So we're talking about housing, we're talking about our sense of personal safety, mental health, food insecurity, the level of power that we feel in the decisions that impact our lives, access to healthcare, cultural competent practices, all right, so going back to how this impact, and how are these drivers of our the health disparities that exist in our nation and in our world. We're thinking about how our identities impact our race, our ethnicity, all of the things that we mentioned, from life expectancy to access to transportation to access to healthcare, all connect with those identities, all connect with where our neighborhoods are located, where we live, our socioeconomic status, our different identities around gender, whether we have proper documentation to access even to health insurance and to the basic needs that we have. And so with that conversation, also there are ways in which we as practitioners and in our different roles could do to overcome all these disparities and at least heal a little bit from all these years of inequity. So some examples of doing that is the ways that we think about how our conscious bias impact the way that we make decisions. And some of us are making decisions around policies. Some of us have the opportunity to share our power in the positions that we have. There are ways in which we can do partnerships to address and leverage a little bit that unequal field. So, like I mentioned earlier a little bit, there is a difference between this idea of equality and equity. And I'm sure a lot of you have seen this iconic image that we have here. And so going back to the point that there is different needs for different resources in order to create more equity. There is sometimes this assumption that by giving the same amount of resources or by creating a policy or doing something that is only looking at things through one lens creates equity, but that's not the reality. The reality is that our different identities create points of privilege and inequity at different points, and so we need different resources. Raquel, do you want to go on the next one?
Yes, I think so as we're thinking about the social determinants of health, as we're thinking about all these pieces around what creates someone's health, as we think of economic stability, I want to bring up that that means employment, your income. So when we talk about somebody's health, a job has direct impact on somebody's health. When we talk about the built environment, we're talking about transportation, we're talking about safety, we're talking about is there walkability. For education, we're looking at language, we're looking at vocational, higher ed. For food, we're looking at hunger and access to healthy food. For community and social context, looking at people's social integration matters so much. We're thinking about the idea of stress. I saw somebody put stress, and that's such an important part of people's health outcome, how much stress they experience. And so the healthcare system is what about access and how far is it that you have to get there, and what about your provider and them understanding the cultural background that you come from and how to talk to you about your health. And so these are the social determinants of health. These are the things that every day build us, build our health. And so we can't exist, when we talk about people's health, we can't just talk about access to care. We can't just talk about healthcare. We have to talk about all the pieces that have people's impact. And that's why as we're having this conversation, these are the pillars of what a well-rounded, healthy person needs to be stabilized in order for them to reach their maximum health. In this next slide, I love this image. It's a fish in a bowl, and there's a little bit of a crack in the glass, and it's really talking about people's environment. And so as we come off and think about people's social determinants of health, it's impossible not to think about, well, what does that then mean? Because context matters in creating health equity. And so it says here, if the bowl in which a fish lives is dirty, or the glass is cracked and the water is leaking, the fish will never reach its full health potential, despite any individual effort. Although the life of a person is clearly more complex than that of a fish, this metaphor illustrates the futility of only addressing individual behaviors without considering the context. And so, as I think about in my work in creating youth development programming and opportunities in the city, I think a lot about the idea that I have to think about where we provide programming, how we provide programming. We've made a conscious decision that our programming that we're going to provide for young people is going to be in their neighborhoods, because we know that each program needs its own identity and needs to address that local community. And so none of my programs look the same. But we could be doing so much more in thinking through where are people coming from, what are the communities we're serving, and are we asking that question? Is where do people come from? Are we intentionally thinking about that? Just being nice to everyone doesn't necessarily mean enough. Being kind to everyone isn't necessarily enough. And really understanding what their background needs are, and really getting a sense of then how do we tailor whatever services we're providing, or whatever behavior I'm having as a person, as a human, in order to think about who's my audience and what perhaps they've experienced. And we'll never really know that. Sometimes we don't have the capacity to really do that background, but I think that's why it's best to operate from the place of being like, let's just assume that nothing is a given. Let's just assume that this person is experiencing difficulties and challenges, not just by looking at their clothes or looking at looking at their resume, but let's come into the work with the assumption of that and let them tell us. And so for the idea of being a fish, with a cracked bowl, we know that that bowl is its whole system. It's his whole, it's his neighborhood, it's his own. And so when the neighborhood has poverty, or when the neighborhood has like high levels of substance use, or a neighborhood is struggling with, the education system, we know that creates an ecosystem for people not to reach their best health potential. So we're going to show this 1-minute video really quickly, and have a quick reflection.
Raquel or Kathy, nobody can hear I think you're working on that, but we haven't heard it.
Okay, thanks. Sorry, y'all.
I'm gonna send a link on the chat so everyone can see it.
Hopefully we'll get it up.
I put the link in the chat.
Yeah, so can we give folks like a second just to watch the video real quickly? Our apologies. So this video was Dr. Jerome Adams, the Surgeon General of the United States. He recently pointed out that Black Americans are more likely to have pre-existing conditions and lack of access to health care, and that he has high blood pressure, asthma, heart disease, and is pre-diabetic. He stated, "So I represent the legacy of growing up poor and Black in America." So if you weren't able to see the video, that's a summary of what we wanted to show. And with, so with that said, the legacy he refers to is based on the reality of a key social determinant socioeconomic status. So he talks about that it's because of his socioeconomic status, which is one of the social determinants of health, that he finds himself in this situation. Black people are not more susceptible to contradicting the coronavirus that leads to disease COVID-19, but that there are often existing comorbidities, which are multiple health having different health conditions, so more than one, due to inherent weakness in the U.S. healthcare system that may lead to poorer outcomes and higher mortality rates from the disease. And so this is the intersection that creates chaos, right? Here is where we find that we are struggling, with a healthcare system that is very fragmented, while at the same time dealing with historic health disparities that are being carried upon. And so when you mix the two of them and we're in the middle of a crisis, this is where we see the disproportionate rise all the way to the top. So it's not that we are in any way more susceptible as people of color or Latinos. It's that because of, one, we could have many pre-existing conditions that are already, because of where we grew up. I know that, like, for me, I grew up in with asthma, and as a child we grew up near a train station because that's where we could afford to live, and we know that being near, that living near tracks and living near trains and the pollution that they create is worse for me, for my asthma growing up. I also knew that there was we had lead in the paint in our house, at our 3-decker, when I was a kid growing up, and I got lead poisoning. And so that was another issue because of a socioeconomic. And so then, I live in a 3-decker near a train station with lead in the paint. What does that do to me in my long-term health as an adult? And so, that things like that, of where people live and access, or what their education, all those, when you start to overlayer them, is when people really start to get stuck in levels of managing which crisis can they manage first, right? You're at the point where you're like, I have so many crises right now that I have to worry about my housing, I have to worry about my transportation, I have to worry about my childcare. And so when I have so many things going on, and maybe I drop the ball in one of them, how does society immediately come to judge me and say that I am messing up, keeping all my balls in the air? And so, the Surgeon General, who is, the leader in this conversation of health, and they are using themselves as an example. And so this is the challenges that we're coming from. So then we want to talk a little bit more about what we're seeing here in Worcester, Massachusetts.
And so here we sharing a little bit about the Latinos in Massachusetts within this crisis. And for example, we see one of the highest communities that have the highest rates of infection of COVID-19 for Latinos is Chelsea, which is a community that is predominantly Latinx. Something that we know too is that a lot of the folks who live in this community are those essential workers that are in the front lines of our grocery stores and healthcare and all those essential services. And so that's another example of all of those of the disparities that are existing, and how predominantly Black and Brown communities are the most impacted. And also the lack of data that we are collecting around these matters. Something that we have on this slide as well is some of the things that are taking place within this crisis and the things that we are missing, that we are not doing. Another thing that I wanted to point out as we are having this conversation is the important, and I think this is a very complicated conversation, and it could be a whole another conversation, but is this idea about collecting data and demographic data. Historically, communities of color don't want to share this information, and there is reasons for all that mistrust. But at the same time, we know that numbers and data are things that are drivers that allow us to allocate resources and document and show all these inequities that exist.
Exactly. So I'm gonna just read these out loud for those that are not seeing these on the screen. And so right now, the three biggest challenges that Massachusetts is facing is that there's no guidance from the DPH. From DPH, we have race ethnicity data, but it's not illuminating or actionable. There's no other demographic factors being collected, reported, like socioeconomic status, language, disability, occupation, age, sex, reported only for deaths, reporting only for positive cases and deaths, not for testing. And so these are the things that are really missing. And then there's no action. The state should monitor racial inequalities and enforcement of public order, which essentially talks about the idea of who's being policed, who is disproportionately, how will we know that any community was disproportionately policed during this crisis if we're not collecting any of that information of where we're doing that. The state should monitor inequalities in the application and impact of clinical standards of care. Again, who is being impacted by the standards of care, like which communities are being neglected, perhaps where are resources being allocated. And then the final one is the state should report regularly on actions they're taking to prevent and respond to racial and other inequities that are observed. And so I think what we're looking at is that if we don't know that there was an injustice done, was the injustice done kind of thing. And so that's data really will drive that conversation. And so how do we, one, build trust within communities in order for that to be something that's a reality for us to collect? I think that, historically we have done some really bad things. Systems have done really bad things with data, to target people, to marginalize, to do all sorts of things. And so how with the history of pain, how do we move forward in order to create justice for folks that generationally, historically have experienced injustice? And so there has to be, going back to the idea of like what we can do, there has to be partnerships built within institutions and community folks. Like, we need to open up the table of conversation in order for us to authentically make this change. When we talked about this idea of overcoming health disparities, the idea of reducing stigmas, interventions to improve access to quality care, policies addressing systemic inequalities, sharing power with communities and increasing resiliency, and then the partnership one, are things that are tangible for us to do as a community. But until we can authentically decide and say it out loud that these disparities exist because of systemic barriers, until we can say that, all of us say it, then we're not going to ever be able to really do the work that's going to create the change for us. And I think that's the hardest part. That's the part that we as people can do to push our systems to recognize this, to recognize that, when we think about zero tolerance policies, what does that do? What has zero tolerance policies done historically? When does somebody decide that, oh, you've crossed the line, and how do we eliminate those kind of decisions, or the entrance of bias into decisions in that way, where one person can just decide if somebody behaved right or behaved wrong or did the right thing or did the wrong thing? How do we use tools, equity tools, and the work that we do to ask those questions? Those things exist. We just have to remind ourselves that every time we are creating a policy, or every time we are creating a coalition, is that we're asking ourselves those key questions of who is at the table, who is not represented, how are we gonna change this table in order for it to meet the needs of those that we want represented. If we're saying, well, we tried to get the community to show up, but they just didn't, so we don't know what to do. I think that the main question is that you really didn't try hard enough. Like, what strategies did you do to try? And is it the strategies that they use when they organize within themselves? And if your system is not using those tools, then you did not do a proper invitation. One of the favorite when I worked with direct service with young people, I used to always tell young people this idea of what like a proper invitation feels like. When I was saying, like, well, we're gonna invite our families and friends to something, and then people didn't show up, and I would say, what happened? Why didn't they show up? And they're like, well, we invited them, but they just didn't come. And I'll say, when you have a party, and I don't know how you all do, but when I'm having a party, I gotta think about all my friends and the complexity of their needs. I gotta think about my friend who never uses social media, right? I gotta think about my friend, so I can't make just a social media invitation. I think about my friend that needs the personal phone call because they always feel, that nobody likes them, and so they need a little bit of extra care in the invitation. I think about the friend that likes the proper invitation and needs enough time to RSVP, and all those things in order for me to have all the people that I care about and value to come to my party. And so as we think about creating equity in this time where people's health is really at crisis, and we're thinking about how do we build those bridges within the organizations or the work that we're doing, we really have to think about the invitation and the people at the table that are making decisions, and how we can open them up, and how we can, using data and using conversations like the one we're having today, find give strong arguments of why it's important for us to address the idea of inequity, and what are the outcomes of when we operate without using equity as our front, like as our North Star. So we are not doomed here. There is plenty going on in our community, and many communities that are really looking to address this idea of the crisis that we're in right now. And I think it's important to highlight the work that is happening that hasn't taken a system hasn't having to come in and operate it, but it's being operated by the people in the community that care. And it's Mutual Aid Worcester. I want to give a shout out to all those that are participating in whatever capacity they have, from the people. And so to give you a quick background on Mutual Aid Worcester, it's a network of community folks that have come together to open the dialogue between those that are in need and those that have to give, and those hats switch back and forth. Sometimes you're the person that is in need of something and you put it out to the community for support. And sometimes you are the person that has extra resources and you can give. And so what we have seen through the mutual aid work is that they have been fundraising money to help people with rent assistance or for transportation costs or for doctor's appointments. We've seen people that use their hands to craft things to help healthcare workers, or just give people protective masks that have to go out for employment or for their personal needs. We have seen people that have stepped up to deliver food and get food to places where people have access issues, and so helping eliminate a barrier about access. And there has been, I can give many, many more examples of the beautiful work that's happening between Mutual Aid Worcester, and I strongly encourage folks to check out the Mutual Aid Facebook page and see the ways that they can either receive the support that they need or recommend folks that need support that they need, but also if there's an ability for people to give based on whatever people have to offer. And so we are not doomed, because through something like Mutual Aid Worcester, we have seen how when we're in crisis, community can step up and is willing to with big hearts. And I think that that's something to inspire us through this very difficult and for many dark time, is that there are people that are still able to respond and have plenty of resources to give, or people that don't even have that many resources and still give. So we wanted to kind of close out with reminding ourselves that there is ways that one person can make a difference, that you don't have to be part of a huge system in order to do something during this, that there's something that you can do as one individual person, but we know that collectively through this network, we've been able to be stronger.
Yeah,
Kathy, you want to add anything?
Just to add to that is also the reminder that systems are created of individuals. So we, within the set of choices that we have, we do have the capacity to be intentional and create changes from whatever, position we're at, from whatever we can do. People do show up. For example, not in Worcester, but something that is also constantly in my heart and my mind is what's going on globally, and especially in Ecuador, because that's where I'm from. And I've seen how, like, at the end of the day, is people showing up for each other that is, it's helping, because the government is not there. And a lot of the times, like, systems, not a lot of the times, but all of the time, systems have failed us. So the power of community is, what's going to help us overcome this.
So we just wanted to open up for some questions. We are extremely thankful for those that have chimed in, and we apologize for a little bit of technical difficulties. But I think that, my closing thought is that as long as we are conscious actors, I think that we can really make changes for ourselves and also changes for our community. Asking those critical questions from ourselves and from the systems that we interact with. So thank you all. I'm going to give it back to Amy.
Great. That was incredible. Both of you are so talented, and things were so nicely put and so clear. I'm really thrilled. In response to our paying attention to this issue, and I'm going to try to bring it up on my slide deck, steal the screen from Kathy while you guys are taking questions. But City Councilor Christian King has brought forth to the City Council, I guess is a proposition you call it, that we start taking demographic and racial data around COVID deaths. And so he's asking for, and again, I'm going to put up the number and how to access it, but he's asking for those of us that do care about this topic and issue to call in to the city council meeting and just express our support for that initiative, in the recognition that, as Kathy and Raquel both said, if we don't have the data about the problem, if we're not measuring the problem, we're not going to make progress on the problem. So we do need to kind of step up and let people know we do care about this. This is impacting our community, and if there's something we can do, let's. So I'm going to do that. And then I guess if people have a question for Raquel or Kathy, you could just raise your hand and get called on. And I'm going to try to bring up that.
Or you can
slide.
put it in the chat and we can answer it.
Yeah, either way, whatever's better for you. If nobody has a question and people would like to use a few minutes to talk about resources that they have through this, that would be awesome as well. I know in the beginning, Deb Bunkers here talked a little bit about what's going on at U Inc. I believe Narissa's still here to let you know that Worcester Acts is still taking referrals for families that have young children. Kwame, I see you there, yay, about changes in WIC and what's coming with that. I also saw Planned Parenthood wanted to let us know that they are still serving people, as well as Pathways for Change. So if anybody, Narissa, do you want to jump in? You look ready.
Sure. Okay. Hi, I'm Narissa Hopper-Ketter, and I'm a community health worker for Worcester Addresses Childhood Trauma. I'm a resilience navigator. We work under the umbrella of UMass Memorial. And yeah, we are definitely still taking referrals in intakes. Right now, what we're doing is more or less sharing information, as well as trying to educate our families and make sure that they're aware of all the changes going on with, you know, the response to the COVID-19. We're making sure everybody knows where to get the resources, as far as with medication, groceries, activities with the children. Things seem to be going well, mostly for the families I check in with. Unfortunately, my main concern seems to be that some families are at home and the children are doing online learning, but they're only using their mom's phone. So they only have access to mom's phone, and it could be mom at home with 3 children, and that's pretty difficult to do. So well, right now I'm trying to get some tablets for these families that are in need. But for the most part, overall, people are doing well. They're getting a little stressed being, you know, cooped up with the children. And I'm just trying to help them be positive, be healthy, be creative with your time. And just doing check-ins. I notice now the difference when I do a check-in. Definitely staying on the phone a lot longer. Clients who weren't typically answering their phone now answer their phone and are up for talking to lengths of time. So that's good. And I could kind of feel out the family, see how they're doing as far as, you know, their mental health, make them laugh. Things are going pretty well. So if you guys know of anyone that needs services and they need help, we're definitely, you know, still open and up and running. We're working from home, but we definitely would love to get some referrals and reach out to people and let them know what's available for them out there in the community.
Thank you. Kwame, you want to go to you?
Can I go?
Yeah,
Nobody's
absolutely.
ready?
Yes, you can
Yeah,
go.
hi guys. Yeah, this is Wendy from Pathway for Change, the local rape crisis center. So our offices are currently closed, but we still providing one-on-one counseling through the phone with our clients and significant others that are impacted by sexual violence. And we also are doing a lot of like virtual kind of meetings in the groups that we carry right now. We have a youth group from Fishburne State University, And if you guys have any clients that you think it would be great to have any kind of like a group, virtual group counseling, please don't hesitate to send their referrals to Pathway for Change, and you can call at 1-800-870-05. Sorry, 1-800-870-0590. And I think I already wrote down the number. And like I said, our services are free and confidential, and we still supporting our survivors for sexual violence.
Great, thank you.
I'm
Go ahead,
sorry.
anyone jump in. No, feel free to jump in.
I was muted, so I was talking and I didn't realize it. Sorry. So right now, a lot of WIC clients are not using their benefits. As of last week, 200 out of about 900 people who receive benefits did not use it. And it's understandable because, you know, going out of your house right now is not ideal. So if you know any WIC clients, if you can please ask them, anybody can go shopping for them. And also, ideally, WIC benefits do not roll over the next month. So even if they don't need it for this month, some of the items can be stored for later months. So if you can encourage all your clients to use the benefits. Thank you.
Thank you, that's great. Other people, comments, questions, things you'd like to share, feel free to just jump in.
So Raquel and Kathy, hi, it's Susan Emilet. Thank you so much for your presentation. I had put that question up. I don't know if you saw it in the message stream. I'm just wondering, in terms of your work with young people around, you know, these ideas and issues, what kind of you know, techniques have you found to engage them that have worked in the past? And just wanted to hear a little bit more about your practice in that way.
Sure. Yeah. So, so I've run and let me clarify, make sure I understood your question. Are you asking about doing equity work with young people?
Right, exactly. Trying to help them better understand, you know, I think some of the things that you were talking about earlier about, you know, the power of stereotypes in our world and, you know, implicit bias, and really helping them think about that. Those are really difficult concepts for young people to first kind of get and engage about. So I'm just wondering how you go about that in your work. Yeah.
Thank you for that question. I think I would say that it's actually harder for adults to understand it than young people, which has been a, you know, it's always a funny misconception. So I have also worked for public health for a few years. And so I think that for me, when I came from youth development to public health back to youth development, the crossing into public health and having conversations about health equity was so easily understandable to me. And I was able to consume the concept so easily because we're in prevention work, in youth development work. And so if you think about that public health idea of prevention of things spreading, and we are in the idea of preventing young people from having poor outcomes, it's essentially the same exact thing. I'm saying that because when you talk to young people about preventative behaviors, by talking to them about choosing healthy ones, it's the same narrative around, well, why do we need to have a conversation about you possibly having poor behavioral health outcomes? Like that question of, like, you know, I'm talking to you about making choices, makes it really easy to start talking about, like, well, what has historically happened? And so talking about their families has been it's been such a healing process for them to feel like, oh, so you mean that perhaps poverty in my life and my family isn't because my parents are just bad, you know? That kind of conversation is really powerful for anyone, to think about, like, intergenerational, like, narratives. And so I used to run an anti-racism youth group with young people, and they used to get into some awesome conversations because, you know, when we were talking about things like tokenization, so many of them were like, tokenization is a thing. Or when we talk to young girls about colorism and the power of, you know, where these ideas of like different skin color and which one is better and which one is worse. It's actually really, really healing to young people. And so what we used to do was we used to talk about power first, always like introduction of power before you could talk about any other issue, because young people need to understand how power works. I remember giving an example to young people about power, and they would say things like, well, if police abuse their power, let a police officer who abuses their power come to my neighborhood, and me and all my people will be there. And I was like, that's true. That in that one moment, perhaps somebody who is abusing their power can meet a group of people that are going to, you know, stop them or whatever. And I was like, but what happens if that person who doesn't have power against all those people calls up their system that supports them, and then their system comes? I was like, do you have a system that's more powerful than their system? And so we used to talk a lot about that idea of how power is leveraged and moved around, and how you have situational power versus systemic power. And once they understand power, everything else falls into space. Then they understand systemic racism easier. Then they understand. And so I know that from other youth work, that friends as well, is that the sooner you start these conversations about who has power and who doesn't have power, is the sooner that you can then start to share power with young people. Because
Raquel,
once they understand, sorry, go ahead.
No, that's a perfect example. That's what I was looking for, you know, having opportunities to have anti-racism groups with young people. That's a perfect example of how, you know, that level of engagement can happen. And, you know, that was exactly what I was looking for. Thank you.
Yeah. And to add to your question, the last little piece now that you said that, is that in any focused content group that young people have, there's always another avenue. So if you're, you know, for example, you work with young people who are doing education around sexuality education, like there's a whole like stream of power in that they can connect so deeply to, that you can talk about injustice with any single lens. And so I did an anti-racism youth group, but what I found is when I was working with youth who were accessing college for the first time, there was a whole avenue to have that conversation with them there, because power played out in their lives there, and they could have the same unpacking and healing in the same capacity. So I always think that it's important to bring in the power conversation in any single thing with young people. Thank you for your question. Sorry, that was a long answer.
Kathy, did you want to jump in on that too, or add to it?
Yeah, the only couple of things that I want to add is that, for example, at the division, we run a Recreation Worcester program. And I think young people, from my experience, are always acutely aware of what's going on in their lives and their identities, and are ready to have these conversations. So for example, in our Recreation Worcester program, a couple months ago, we were partnering with the Division of Human Rights and Disabilities to talk around fair housing, and through storytelling and like drawings and things like that, we had a conversation around that, and our young people were extremely engaged in that activity. And these are 4th, 5th, and 6th graders. The other thing that we constantly do in our program is we have conversations with our staff, which are also young people, and we talk about the intentionality of why we hire young people from the neighborhoods of the young people that we serve, and how that connects to creating equity, and why representation matters, and why having people that look like you, it's important for healing and for feeling seen in your community. The other piece that we do is with our youth council, where we talk about what does it look like for a city of Worcester to care about our needs and to have our voice heard, and not just tokenized in some board or group.
Beautiful, thank you. Agree. It's never too soon to start talking about this stuff. And with every audience too, that's one of the plugs I like to put in. It's important for white people and white children to be aware of this and have this understanding as well. A lot of times they're left out of the conversation because they do have privilege, but when they don't understand that, is part of when problems and systems get perpetuated. So for all of us to better understand this, it makes a better world. And I do appreciate that both Raquel and Kathy, you know, they walk their talk. They do think very inclusively in everything they do, and the city's that much better for it. So we are just eternally grateful for you being brave and, you know, just bringing this to the forefront again and again and again, even when it's unpopular and people don't want to hear it or talk about it. That's the time when it's most important to hear about it and talk about it. So I'm glad we're getting forward momentum in looking at this through the current crisis, using a health equity lens to understand what's happening in Worcester. So you can see, I think that the slide, I put up the slide about Councillor King's initiative to ask the mayor to get the Board of Health to provide race and ethnicity stats in the COVID cases. If you haven't already seen them, they're doing meetings every night. The city manager and the mayor talk about what's going on. They have recent updated data on how it's impacting Worcester and surrounding counties, but none of that data has really been teased out by race. So this is asking for us to look at that and pay attention to that. It also really connects to the whole idea of adverse childhood experiences and trauma. And the more obstacles in your path from an early age, the more likely you are to have an early death. And all of these factors, as Raquel and Kathy both showed us too, these things magnify. Once you get on the path of not having your needs met, you get more and more of not having your needs met. So anything we can do to bring marginalized people into the center of our awareness is really not just good for them, it's good for all of us, and so important to do. I'll paste this on our Facebook page. And of course, if people have resources or information they want to share, we are always happy to share stuff out. And I know a lot of other agencies are represented here. They're doing the same thing, just trying to get information out as often as possible. If we don't have any more comments or questions, I just want to tell you about some of our upcoming trainings. Our next one is going to be May 5th on domestic violence. Again, another really important topic, a topic that overlaps with many of the other things we've been talking about. And we have the YWCA, Deb Hall and Craig Mortley are going to be giving that training. So I know they both have a social justice, health equity lens in their work as well. Any other thoughts, comments? Hearing none, we can call it a day. I'm so grateful again.
Hi everyone. My name is
great.
Precious. Hi everyone. My name is Precious. I'm from the Boys and Girls Club of Worcester, and I just wanted to say thank you so much for the presentation, and also share that the Boys and Girls Club is also giving fresh fruits and vegetables every Fridays between the hours of 12:30 to 2:15. So if you know any families that are in need of that, they're welcome to attend. And then Monday to Friday, they also give lunches and breakfast for the kids.
Thank you so much. That's awesome. You guys are doing great work at the club. Anyone else wanted to chime in on something they're doing or ways that this is being looked at?
I just wanted to add that from the Division of Youth, we have gone with our programming virtually, and so we are creating content every week for families and young people and children to do at home. So I just want to invite you all to check out those resources, share them if you can. If you go into the City of Worcester website and type Recreation Worcester, you will be able to check out our playlist and all the information on those resources.
That's great. Thank you.
And I'd like to add, I put this in comments, but if you go to the Mutual Aid Worcester Facebook page, there's a food pantry that was set up last week, and I believe it's going to be every Friday from 12 to 2. Although last week was the first week and they ran out of food in 45 minutes, so they're doing some fundraising.
Wow.
In the Denholm building, and it was specifically set up for refugees and people who are potentially undocumented who don't feel comfortable going to food pantries where they may need identification. So that's going to be every Friday at noon.
And I saw that Deb also in the chat had asked about sort of geographic places. And I know that the mutual aid group has neighborhood groups as well. So they are kind of trying to approach it from that place too, of who's right there near you, who could help you. All right, if there's nothing else, I just want to thank you all again for being here. Thank you to the Worcester Area Mission Society, Clark University, Worcester Addresses Childhood Trauma, Clemente's in the house, the city, of course. We're very grateful for Raquel and Kathy coming to speak with us. And this has been recorded, so it'll be available after. We'll get that out to people. So if you'd like to, use it with your staff or your family or share it out, we would love that. We really do want to make sure that these conversations and issues stay centered and in the spotlight. So thank you so much to all of you who just care enough to be here today. We really appreciate it. And we appreciate all the work people are doing. It's hard to be positive and optimistic these days unless you live in Worcester, because here people are showing up for each other, caring about each other, and doing everything we can do to be in this together. We're real grateful.
Thank you.
Thank you.
Bye, Amy. Bye, everyone.
Bye,